Hello and welcome. Today, we're diving into a rare but serious eye condition, Topiramate-Induced angle closure glaucoma. This is a condition that can arise as a side effect of taking the medication Topiramate, commonly used to treat conditions like epilepsy and migraines. Understanding this condition is crucial for both patients and healthcare providers alike. The primary cause of this glaucoma is the use of Topiramate. While Topiramate is effective for certain neurological and psychiatric conditions, it can, in some individuals, trigger a cascade of events within the eye leading to angle closure. It's important to note that not everyone taking Topiramate will develop this condition. Certain predisposing factors may increase the risk. Let's delve into the how. Topiramate's mechanism of action involves multiple pathways in the brain. However, in the eye, it can lead to swelling of the ciliary body, the structure responsible for producing aqueous humor, the fluid that nourishes the eye. This swelling causes the lens and iris to shift forward, narrowing or completely closing the angle between the iris and cornea. This angle is crucial for the drainage of aqueous humor. When the angle closes, fluid builds up inside the eye, rapidly increasing intraocular pressure, or IOP. This sudden spike in IOP can damage the optic nerve, leading to vision loss. Epidemiologically, Topiramate-induced angle closure glaucoma is considered relatively rare. However, it's vital to be aware of its existence, particularly among those who are prescribed Topiramate. Studies suggest that women may be slightly more susceptible, and those with pre-existing narrow angles may also be at higher risk. The incidence rate is still being studied, highlighting the need for continued research and monitoring. The signs and symptoms can be quite dramatic and typically develop within days or weeks of starting Topiramate, or after a dose increase. Patients may experience sudden eye pain, redness, blurred vision, halos around lights, and nausea or vomiting. It's crucial to seek immediate medical attention if you experience these symptoms while taking Topiramate, as prompt intervention is essential to prevent permanent vision loss. Diagnosing this condition involves a comprehensive eye examination. This includes measuring intraocular pressures (OPO) with tonometry, examining the anterior chamber angle using gonioscopy, and assessing the overall health of the eye and optic nerve. A thorough patient history, including medication use, is also vital for accurate diagnosis. Optical coherence tomography (OCT) may be used to assess the angle and optic nerve. While there aren't distinct types or classifications of Topiramate-induced angle closure glaucoma in the traditional sense, the severity can vary significantly. Some individuals may experience a mild increase in IOP with minimal angle closure, while others may have a complete angle closure with dangerously high pressures. The speed of onset and the extent of angle closure will dictate the urgency and intensity of treatment. The primary goal of treatment is to lower intraocular pressure quickly and reverse the angle closure. This usually involves a combination of topical and oral medications to reduce aqueous humor production and constrict the pupil, pulling the iris away from the angle. In many cases, discontinuing Topiramate is also necessary. If medications are insufficient, laser iridotomy may be performed to create a new drainage pathway for the aqueous humor. In some cases, surgery to widen the angle may be required. Preventing Topiramate-induced angle closure glaucoma starts with a thorough assessment by the prescribing physician. Patients with pre-existing narrow angles should be identified and carefully monitored. When initiating Topiramate, patients should be educated about the potential symptoms and instructed to seek immediate medical attention if they experience any visual disturbances or eye pain. Regular eye exams are crucial, especially in the initial weeks after starting or increasing the dose of Topiramate. The prognosis for Topiramate-induced angle closure glaucoma is generally good if diagnosed and treated promptly. However, delayed diagnosis or inadequate treatment can lead to permanent optic nerve damage and vision loss. Recent research focuses on better understanding the specific mechanisms by which Topiramate affects the eye and on developing more targeted therapies to prevent or reverse angle closure. Ongoing studies are also exploring potential genetic predispositions to this condition. Keeping up with the latest research and advancements can help to improve patient outcomes and minimize the risk of long-term complications.